Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe in the studios of 89.3 WBLD and Civic Center TV, our flagship TV and radio stations on our family of media outlets for the Oakland County Megacast. As always, joining us also on Comcast Channel 15 and AT&T Channel 99 in Birmingham, Bingham Farms, and Beverly Hills is Birmingham Area Municipal Access. Additionally, in the Bloomfield Hills area, 88.1 WBFH, The Biff. And on Facebook Live, our partner today is our friends up the street here from us at the Orchard Mall. We thank Kelly Woodley and the entire team over at the Orchard Mall for joining us for today's edition of the Oakland County Megacast. And as always, from her studio at home in Keagle Harbor, here is Ronnie Dahl.
Hey, Tyler, happy Friday.
Happy Friday, Ronnie.
It's Valentine's Day weekend. Do you get your pets anything?
I have not previously done so. I have some treats for them. I may be very liberal with giving them treats over the course of this weekend. They've been great. They've been great lately. They haven't been knocking things over. They haven't been getting into things that they shouldn't be getting into. And that's with me being gone long days this week for 4 meeting nights in 4 days. And we'll see. Today's just a regular day. This will be when they rip things apart. But you know what? It's a holiday weekend. I'll give them some love.
I went out yesterday and I tried to find Trixie a cute like red sweater or something, but the supply is so low right now in the stores for dog coats and dog sweaters, and plus she's a big moose, and so it seems to be harder to find things to fit her. So Trixie may have to just settle for a new toy and a bully stick, because we know she loves those. And that's kind of like giving a bull love, right? Another animal.
It's true. It's animal love going all around. And on top of that, I haven't seen really, and I haven't really been looking, so I can't really say definitively that I haven't seen much Valentine's Day wear for dogs over the course of time. I mean, there's outfits for dogs all over the place, but specific to Valentine's Day, I don't really know about that. So maybe there just isn't something in existence. That might be something to get on.
So 1 year for Valentine's Day when we had our Cocker Spaniel, before she passed away, I had shirts made for us. We had matching shirts. They were pink, and it said Papa's Girls for my husband, and then but they were sparkly. The letters were sparkly. Yeah, I'm one of those crazy pet parents. I admit it, and I am not ashamed of it one bit, Tyler.
No, you know what? It's all part of being a pet owner. Some pet owners are the kinds that are just inseparable from their animals. They love them unconditionally. I'm like that with my cats, and I know with dog lovers too. And just in my own family, I have some extended family that it has a bunch of dogs, and they love their dogs, and they take them everywhere with them. So, I mean, the love of your animals is something that isn't something you need to explain to other people. It's you either have it and you understand it, or you haven't had a pet before and don't understand it, and will maybe someday.
There was a great segment this morning on Good Morning America. It was a cute segment. It was about all these doodles and this group in Atlanta. It's called the Dude Squad. And they all have these various forms of doodles. And they get them together. They go play together. But they also are trained to go into like facilities, nursing care facilities and hospitals, places like that. But they had this huge photo shoot with, like a convertible red car and pink heart balloons, and the doodles were all dressed up. It was super cute. It was really cute. They have I guess they have an Instagram, but it was really just kind of a way for neighbors and friends to get together and spend time together, but also allow their dogs to play together. So it was called the Dude Squad.
Very nice. Yeah, that sounds like a great thing to be doing right now. It sounds like something that's really nice for the animals and for the pet owners as well. Get some socialization in and something joyful in our lives. I'll have to check that segment out. That was from Good Morning America, you said?
Yeah, so it should be on their website and their social media shortly. But I'm also like, okay, who trained their dogs? Because their dogs were sitting pretty, posing, 7 dogs together. And, they put cute outfits on them and this, that, and the other. And I'm like, oh, Trixie's been through training. She's getting a lot better, but I don't see her sitting still like that for pictures and a photo shoot.
And when you got a pet that's just a big ball of energy, keeping them still for a split second is a win, but for enough time, for several seconds, to get a good picture, it's next to impossible. Just the family dogs that I've had over my life with my mom and my stepdad, it's always been a problem. They're a couple balls of energy. The current dog, which is the German Shepherd puppy, she is not going to sit still for that. And then the previous dog, Murphy, who was a yellow lab, when he was younger especially, was not going to sit still for a picture. In his older age, as he got more tired and stopped caring as much about running away and playing with the first thing that he sees, they got a little easier. But, these energetic dogs like to have fun, and sitting still for a picture takes away that precious fun time.
Yeah, but especially when you have big dogs like, golden retrievers and German shepherds and labs, they can be overpowering at times. So we are in the process. Trixie has now learned shake and high five. So we're working on stay and lay down, and we'll get there, but we're not there yet.
You got to just trust the process, Ronnie. You got to trust the process. It'll get there.
She's all about her treats, though. That makes it a little bit easier because that dog loves her food.
Yeah, that'll do it. That's one thing that will convince most energetic dogs and other animals as well to slow down and listen for a second. Hey, you might get a treat. You might get a treat. I mean, I can't guarantee anything, but if you're good, maybe I can.
Heather, I want to see you put little scarves on your cats.
I will try. They're not very happy about getting their collars on them, so I'm trying to ease them. I've been trying to ease them into regularly wearing their collars. We'll see how it goes with a scarf.
So we'll jump into the day's headlines now that we're done with our pet talk, because this is not a pet show, but for so many of us, like I said, it's Valentine's Day weekend, so we're spending it and celebrating it, not only with our loved ones, but our loved pets as well. Oakland County, Tyler, is anticipating millions more in federal pandemic aid. So the Oakland County officials are expecting to receive hundreds of millions in additional federal COVID-19 assistance to support its proactive COVID-19 pandemic response efforts. But that is only if lawmakers in Lansing and DC decide to take action on pending supplemental budget proposals. So last month, the state of Michigan recently received that $5.6 billion from the federal government as part of that $900 billion relief package that was passed by Congress this past December. Included in that is a $665 million to support vaccine testing and contact tracing related efforts across Michigan, including here in Oakland County. So the deputy county executive said Oakland County could receive about 11% of that money, which would be about $73 million. But it's only if the state decides to distribute funding straight to the local governments rather than administering it and distributing it through state government channels.
Yeah, we've talked about this before. What's also going to be a factor in this is the solution to the gridlock between the state legislature and Governor Whitmer as well, because if they're going to be distributing this aid, they're going to have to be in some sort of agreement for it to get those dollars where they need to go, and whether that is entirely to straight to local government agencies and instead of going through state government channels, as your article on our website and your summary of the article on our website states. That gridlock is already causing some issues. This is a lot of money that is in great need for these efforts, both on the COVID-19 front and just on the general city and other municipality operational front. So hopefully that's more incentive now with these dollars being impending, getting potentially to our local governments and to people in need in our communities. Hopefully that provides extra incentive to Governor Whitmer and those in the legislature to get some things done.
So there was a great article today in Bridge Magazine. I check them out daily, though. Tyler, Bridge Magazine here in Detroit, or Metro Detroit, they cover the entire state. They are doing some great journalism throughout this pandemic. And what they have found is Michigan is not collecting race data right now when it comes to the vaccine. So you remember 10 months ago, the governor made racial equality a cornerstone of the state's pandemic response. And 2 months after the first COVID vaccines arrived in the state of Michigan, the state still hasn't collected standardized data on race to ensure vaccines are being fairly distributed. Elizabeth Hertel, who took over as director for the Michigan Department of Health and Human Services last month, told Bridge the state is trying to catch up on collecting demographic data on the vaccine. The problem is that the computer system that the state uses to track vaccinations had never been asked to collect the race data. And so for more than 2 decades, the state has been using this record-keeping system. It's called the Michigan Care Improvement Registry, or MCIR, to track the vaccine. So now what the state is trying to do is to try to figure out how to get the data into the ones that maybe was captured elsewhere, such as, electronic patient records kept by hospital clinics and some of these other facilities, to try to get that information and now get it into the system. But still, they have to make that system compatible to be able to collect this information. And so far, more than 1 million Michiganders have already gotten at least one of the 2 required doses of the vaccine. So that's a lot of backpedaling that the state has to do. But we have to remember this was part of a cornerstone of the governor's initiative. And so they're not looking down the line. We knew the vaccine was coming, and you put together this task force to come up with addressing some of the racial issues connected with COVID-19, but yet you're not thinking past what's in front of you. Government.
Yeah, really great article from Bridge, Michigan. You can find that entire article on the website on civiccentertv.com/coronavirus. And as you said, this is something that needed to be anticipated. It has been, as you said, a cornerstone of the state's response to COVID-19, tracking how COVID-19 is affecting minority communities all throughout the state and adjusting the state's response in order to provide equity and equality in the response to COVID-19. The vaccine has to be part of that. I mean, we just talked recently with the St. Joseph Mercy Medical Director. We actually talked to him last week, Thursday, about the issues and the studies on race and COVID-19 outcomes. And part of that has to do with the vaccine as well. So if communities that are primarily minority communities are being heavily affected by COVID-19 and treatment of COVID-19, of course they're going to be heavily affected in similar manners, potentially, by the vaccination process. So making sure that there is equality in distributing the vaccine has to be vitally important if that's the case. And this lapse from the state government is something that is highly questionable, especially considering the emphasis that has been put on since very early on in the pandemic in providing equality and equity in the COVID-19 response.
Also in the headlines today, Tyler, the CDC says fully vaccinated people do not need to quarantine if exposed to COVID. So individuals who are fully vaccinated against COVID-19 do not have to quarantine after being exposed to someone with coronavirus if they are not symptomatic. That's according to the new guidance from the U.S. Centers for Disease Control and Prevention. Fully vaccinated means a person has gone 2 weeks since receiving the second of 2 doses of either the Pfizer or Moderna vaccine, and that they are within 3 months of receiving the last dose in the series. However, if you've been vaccinated and you become symptomatic following an exposure, you should still follow the CDC's quarantine guidelines as well as be clinically evaluated for COVID-19. Now, there is one exception to this, Tyler, and that is vaccinated inpatient and residents in healthcare settings should continue to quarantine following an exposure to someone with suspected or confirmed COVID-19. So a change in the rules from the CDC. When you look at this in its totality, this is going to mean a lot for the healthcare industry and those individuals that are on the front lines, such as firefighters, EMTs, and police officers, because sometimes when you go out for quarantine, that can really have a huge impact on your staffing for whichever entity you work for.
Yeah, it's going to be an adjustment for these agencies to continue to provide the service to their community that they have provided throughout this pandemic, while also maintaining excellent safety standards as well to prevent the further spread of COVID-19 on the job. Fully vaccinated people, of course, as the article states, do not need to quarantine after being exposed unless they're not entirely through the vaccination process. Fully vaccinated, the definition of fully vaccinated is in this article, but that's going to affect logistically how people, not only in the emergency services industries and in the healthcare industry, adjust to COVID-19, but those who are in the vaccination process in other sectors of the economy as well, and how they make their plans should there be exposures in the workplace or those that are in the workplace have been exposed otherwise.
So if you want to read the latest guidelines for yourself, you can do so just by going to civiccentertv.com. Click on coronavirus tab. That's where we post all of the daily headlines. But at the top of the page, we have direct resources. And one of the links is to the CDC. So you can find this information and read through the entire guidelines for yourself. So we're going to take a quick break here on the Megacast. When we get back, we will get the Friday show rolling. And with us, we'll continue the conversation about the vaccines and other things related to COVID with Eric Wallace, the president for the Henry Ford West Bloomfield Hospital. This is the Oakland County Megacast.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times. Hi, my name is Kurt Lawson, and I'm
Great to have you with us here on this Friday morning. Of course, we are going to continue the conversation regarding COVID-19 as well as the vaccine. Really, in 2021, the vaccine is our hope, but it is still a slow rollout because we have to be patient when it comes to trying to vaccinate an entire country. And with us now is Eric Wallace. He's the president for the Henry Ford West Bloomfield Hospital. Always great to have you with us.
Thanks for having me back, Ronnie.
So we know that it is confusing for so many people that are trying to get vaccinated right now. When it comes to your hospital entity, how does that work separately from like trying to register through the county?
Yeah, it's a great question. And as you mentioned, this is one of the bigger challenges that we faced. And I just remind folks that in the history of our country, we've never tried to do something like this. So it is very much a little bit of learning as we go. I would say over the last few weeks, we've had great partnership with both the state of Michigan and particularly here in Oakland County with the health department as we all try to figure out what's the best and most effective way to do this. The great thing about being at Henry Ford West Bloomfield is we're part of a larger system. And so the Henry Ford Health System each week has received an allocation of a vaccine that we are trying to work through and using our MyChart platform to notify folks that are right now in that eligible age group when we have vaccine to have that they can get. We're also partnered with the Oakland County Health Department in trying to support their efforts and sharing some vaccine back and forth as they try to work through their list. I think it was about a week ago in our last conversation with them, they had slightly over 310,000 people on their list, their waiting list for vaccine. And at that time, they had the capacity to vaccinate about 20,000 people a week because of the supply of vaccine. So that's really the only thing that's really making this go slower than we would like at this point is there simply isn't enough vaccine to go around to get to everybody that we want to get to yet.
But for the people that are working in your hospitals that are on the front lines, have you even been able to get through vaccinating all of them?
So I think we're getting toward the end of our vaccination of our team members who want the vaccine. So again, earlier in the week, Henry Ford Health System has about 33,000 folks. We've already at this point fully vaccinated about 17,000 of them, and so we certainly have some full-time, part-time, and then some folks who work with us on a contingent basis that may be getting vaccine at another health system. So. We're closing in on probably about 60% of our workforce that is fully vaccinated, and our work right now is to continue to work with even some of our own team members who have some vaccine hesitancy to help them understand that this is a safe vaccine, and that we really do want to make sure that we get to 100% really of our own workforce.
Hey, Eric, I love that you brought that up because we are seeing that even in the general public as well. Some people are still concerned that they feel like this vaccine was rolled out too quickly. And for those that have members in the healthcare industry and they're saying, wait, I'm not getting it yet, that can kind of add to that concern level as well.
Yeah, I think you see some of our workforce has the same questions and concerns, and we're working on a day-to-day basis to even educate our team members as much as we're trying to educate the public. The reality is, especially when you talk about the Pfizer and the Moderna vaccines, the thing that has made them come out more quickly is that instead of doing the process or the development process one step and step two and step three and step four, they were all done in parallel. The federal government funded the Pfizer and Moderna companies to produce vaccine before it was even approved. So we didn't have that wait that you would normally have in a vaccine development process. And that's really what made it move more quickly. The mRNA technology has been around for decades. In fact, it's been used in the treatment of our oncology or cancer patients for quite a number of years. So we know it's safe. This just happens to be the first time that it's been fully used with a vaccine. But it was part of what was being developed back when we were talking about swine flu and bird flu and H1N1, and then when those kind of went away, they put the work up on the shelf, and it was sitting right there waiting to go when COVID-19 came along. So I'll be the first to tell you, I've had both of my doses of the Pfizer vaccine. You do get a little bit of a sore arm. But that sore arm was well worth it to know that I'm protected at this point from COVID.
It really, a lot of this is about trying to educate the public as well.
Yeah. It absolutely is. And so, we've been doing a number of telecasts, webinars, working with our local chambers of commerce to try to, educate our business partners. We've had, folks from our health system even working in Detroit with the churches there. We've been working with the county health department and trying to put our experts out there so that people can ask questions and that they can get factual answers. I think one of the challenges is in the world that we live is sometimes there is so much information out there that people really have a hard time deciphering it down to what's true and what may be just a little off. And so we're trying to make sure that we use our experts and put them out there. We've got I think a great program coming up next week with all of the local chambers of commerce, where we're going to have, again, a panel of experts out to talk about the vaccine and COVID-19. So we're just trying to be a resource to the community at this point.
And that's great because also it's hard to take individual questions from an entire public because you could end up just doing that. So again, as you just mentioned, it's going to be a vaccine town hall, and that is scheduled for the 18th of February. And people will be able to tune into it right here at civiccentertv.com. And we'll have it on the radio as well as all of our other platforms as well, because again, we're taking questions from the public because someone such as myself, I know I'm at the back of the bus when it comes to the vaccine, which they're saying now could be the fall. So for me, I'm not going through this process. I'm really not so concerned because I know there hopefully will be other vaccines that will come out by that time. Personally, I'm waiting for the Johnson & Johnson because I'd much rather have one shot than two. But it is an important town hall. And like you said, to have the experts be on the panel and answer these questions for the public. And so with that, because we are talking so much about the vaccine, but we're forgetting the numbers in COVID here in the state of Michigan are going down, which for you and your staff, that has to be good, because are you not so overloaded at the hospitals right now?
Yeah, I think where we are now is we saw a little bit of a bump here over the December, January timeframe. Our numbers here locally, we kind of got to probably about half of what we saw last spring. And now we're back down to kind of where we were last summer, with just a couple of folks in the hospital at any given time with COVID-19. I mean, serious enough that need to be in the hospital. Again, I think, as we've talked previously, the great news is we've been dealing with this now for almost a year. And so we're very adept at keeping people safe while they're in the hospital. I'm very proud that, really since last April, we've not had a single one of our team members get COVID-19 from an exposure at the hospital. So, we're in a facility here and locally in this community where we have all private rooms. We do have some restrictions in place to limit the number of visitors coming into the building. But it's a very safe environment. And again, cannot stress enough that if you need care, please get it. We're still seeing too many people that are putting off routine care, screenings, et cetera, that are going to lead to much worse disease when they do finally come back to us. So continue to stress to folks that the hospital is a safe environment. We know how to keep everybody safe, and we want people to get their routine care.
That's good to know, because I know, it's like you said, so many people are holding off on those screenings, their mammograms, their cancer screenings, things of that nature, and they should not be doing so right now. With that, when it comes to going to the hospital, you mentioned there are still some restrictions about visitations. Can you tell us more about that?
Yeah, I think I'm happy to say too, I think next week we're actually going to be pulling some of those back. Just because we are seeing lower incidents within the community, and hopefully we'll be starting to communicate that later today. But right now, we are limiting, only visitors in if there is a significant need, or they have a family member who needs help with, ambulating from one place to another, or, if there are certainly patients that are in life situations, we're allowing family members in. People who are having procedures, we're allowing, a family member in for those procedures. But generally, for just our folks that are inpatients with us for a few days, they can't have visitors right now. And that is a significant burden to both the patient and the family. We've tried to do some really unique things. We've been using things like FaceTime, Zoom, and others via iPads and phones to make sure that we're communicating really well with families. But it's certainly a challenge when you don't have your loved one there in the hospital. There's lots of evidence and research out there that says that patients do better when their families are with them. So like I said, I'm excited that right now our plan is next week to try to relax those a little bit and at least allow a family member to be in with their loved ones.
That will be such a comfort to so many people, and let's hope that the numbers do remain low, because we know Super Bowl was last week, so we could see a bump in some of those numbers, but let's hope that we don't, because it does appear as our numbers here in the state of Michigan, and especially in our community here, are much lower than what they are in other parts of the state. If we can go back to COVID for a moment, because everyone is focused and talking about the vaccine, but like you said, we're nearly going into almost a year into this now, and you know how to treat it better. I feel like people have stopped talking about treatments and also some of the testing for those treatments. I know that before we had a lot of trials going on for like different forms of treatment, like the plasma, things of that nature. Where do you and Henry Ford, your healthcare system, stand in that arena?
Yeah, so there's obviously Henry Ford was in the news last year for a number of studies. We continue to be involved in studies around the use of monoclonal antibodies and how those help with the care of our patients. But probably the biggest one was the study around hydroxychloroquine. That study has since been stopped for a couple of reasons. One is that we saw that there wasn't an effective benefit to the patients. And based on the fact that we were starting to do other things that were effective, it just wasn't being used anymore, so you couldn't really continue that study. I think we've learned a lot about, without getting really technical, that a lot of this is about the immune response the body has to COVID-19 and the cascade of events that can lead people downhill really quickly. And so we know how to treat that now. So what we are seeing is fewer people who are getting really, really sick. We're not seeing as many people wind up in our ICUs. I will say, though, that when we do have people get there, they're still in the hospital for a really long time. The people who do get that sick are getting very, very sick and very, very ill. And so we still are very concerned about that. I'm extremely excited, as you said, that we've seen the numbers go down here in our community and in Michigan. We were worried about a spike after New Year's, worried about a spike after Christmas, and they didn't materialize. And I think that's because a lot of folks are doing the right thing, are wearing masks, and a lot of the restrictions that have been put in place have worked. I know that none of us really like those, myself included. I'd love to go back out to a restaurant and sit and eat. But I think the reality is that they've helped us to get through this period of time without seeing big spikes.
So I had a Facebook friend who was treated and did very well with the plasma treatment. And are there currently any trials going on to continue to look at COVID-19 in your healthcare system?
Yeah, the biggest one is still, again, looking at the plasma treatments, the monoclonal antibodies, and looking at dosages and looking at frequency and some of those kind of things. We know they work. It's figuring out what are the right patients that it works in, what is the trigger that you should use to say, hey, we're going to give that therapy. So it's some of those kind of things that we're looking at. It's not so much yes or no, it's how do we best use that therapy to treat these patients.
Well, hopefully people won't get so focused on the vaccine that that they're going to stop participating in some of these trials, because I will say some of these people that stepped up to be volunteers, not just for some of those trials, but also the other ones that didn't work. They really are some unsung heroes in this, because they were willing to basically be guinea pigs for the rest of us.
No, you're absolutely right. And, the other thing is Henry Ford was a site for the trial of the Moderna vaccine. And it's really been great to be able to participate in those kinds of projects to make the health of our community better. And I think that's, again, one of the great benefits of having a hospital in our community. It's part of a health system that does that kind of research. And the Henry Ford Health System is in the top 10% in the country when it comes to doing grant-funded research. So I think that's a tremendous resource that we have here in the community that we don't always talk about.
So Eric Wallace with us again here on the Megacast. He's the president for Henry Ford West Bloomfield Hospital. The CDC recently announced that those that have been fully vaccinated will not have to be quarantined if they are exposed to COVID-19. What does that mean for members of your staff?
For the moment, not a lot. We still have a lot of our precautions in place, even if our folks that are vaccinated. We know that still today, the most important thing that we can do is mask, wash your hands, and keep some social distance. And so those things are still effective, even for folks who are vaccinated. The truth is that even with a vaccine that's 95% effective, 1 in 20 people can still get COVID, even if you've been vaccinated. And so that's a tremendous efficacy rate, but it doesn't mean that we're all protected until we're all vaccinated or until we get into that point of herd immunity. So I think, we expect that a lot of the precautions that we have in place, are going to be in place for at least through the summer. And I don't expect those to go away until we get to that point of herd immunity. Things like the CDC guidelines around quarantining help to drive our policies about any potential exposures that our team members may have when they're out in the public, and how quickly do we bring them back. But honestly, on a day-to-day basis, it really doesn't change much of what we've been doing, because we've been doing a lot of that stuff all along anyway.
So how are you doing on staffing right now? Because one thing when it comes with the healthcare industry, it's not so easy to fill some of these jobs, because there's some training that goes involved in some of these positions. So how is staffing looking now and for the future in the healthcare industry as well?
Yeah, I think, staffing has definitely been more challenging. I think, a number of folks who came into healthcare didn't ever really think that they would see a global pandemic. I mean, the reality is we haven't seen this in over 100 years. And so I do think that it's taken a toll on some folks. I think we've seen some folks that were, toward the end of their career that decided that maybe now's the time to retire. I think that the training of folks during this time period, whether it's doctors, nurses, others, has been more challenging because of the restrictions that have been in place in hospitals and healthcare settings. And so it's something that we are very focused on, is how are we going to recruit and train the next generation of healthcare folks. And again, partnerships are really important to us through local schools of nursing. Many folks have seen in the news that Henry Ford just signed a 30-year agreement to partner with Michigan State University to help train and develop the next generation of healthcare team members and leaders. And so we're really excited about that partnership as it comes to fruition. But we are in a very tight labor market right now. And frankly, one of the things the pandemic has done is it has made acquiring labor much more expensive. We have nurses that have left our health system to go work in California part-time and make $11,000 a week. That's hard to compete with when folks can make that kind of money going someplace else. So I think it's a challenging labor market right now. We have each and every day managed to staff our hospital very safely, but definitely we're looking forward to being on the other side of this and kind of get back to a slightly more normal labor market to recruit from.
And not even so much for those that are working on the front lines, but what about just regular staffing, like your janitorial staffing, or those that work in, I don't know if the gift shop is still open, those types of positions as well?
Yeah, it's a challenge. I think we're a little more challenged even here in West Bloomfield, just because when you look at the socioeconomic status of our community, we don't have a lot of folks that work in those roles that live within the community. So we are typically trying to recruit from outside, which is a little more challenging. There are people who are afraid to come work in hospitals right now, and that has been more of a challenge as well. So, we've redesigned some of our recruitment packages. A few weeks back, Henry Ford became the very first healthcare system in the state of Michigan to raise our minimum wage to $15 an hour. I will say that was on our plans anyway. But this environment kind of accelerated that. We think it's the right thing to do to help folks be able to work for a living wage as opposed to just getting by and needing to work 2 or 3 jobs. So that has definitely helped us as well. But it's a very dynamic employment market right now.
So if people are out there listening or watching, Henry Ford is hiring.
Absolutely. We want people who want a passion to help others. And I think that's the biggest thing. Skill set is not the most important thing. We can teach you the skills that you need. What we're looking for is people who really have a passion to help other people.
Well, thank you again for being with us. We always appreciate it. And of course, we'll be speaking with you more. You will be on the panel next week for the vaccine town hall. That is going to be on the 18th at 9 a.m. Mr. Wallace, thank you, and happy Valentine's Day.
Likewise.
Thank you so much. I hope you have something special planned.
Absolutely. You've got a great wife who takes really good care of me. So.
Well, good. You guys enjoy the weekend. And again, thank you for your time. We're going to take a quick break here on the Megacast. When we come back, we will be speaking with the communications manager for Humble Design.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's going to be who?
And whether we wear green
Or blue. But one thing we can all agree on, to help stop the spread of COVID-19, wear a mask.
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 The ball's in your court, Michigan.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Great to have you take time out of your Friday to be with us here on the Megacast. As a reminder, you can always catch us on Civic Center TV, Birmingham Area Municipal Access, Channel 15 on Comcast 99 if you have AT&T. You can also tune us into the radio by just listening to 89.3 Lakes FM, 88.1 FM The Biff. And we also want to say thank you to our friends over at the Orchard Mall for allowing us to live stream today's edition of the Megacast on their Facebook page. With that, we are in the middle of the pandemic. The crisis continues to linger on, but one organization here locally is taking people that were once homeless and giving them hope. With us now is Lisa Crawford. She's the communications manager for Humble Design. Great to have you with us.
It's great to be here, Ronnie. Thank you.
For those not familiar with Humble Design, tell us about the organization.
Well, it started here in Detroit in 2009. So our founder had moved here from Miami and was volunteering at a local food bank and made friends with someone who she learned was homeless after leaving a domestic violence situation. She'd never met anybody that was homeless before, and it weighed heavily on her. And she was so excited for her friend when she got a place to stay with her and her kids, and didn't realize that, of course, she didn't have any furniture. So it was a completely empty apartment. And when she went to visit and saw that they were sleeping in little nests of blankets on the floor, she asked all of her friends to donate their extra furniture, their extra stuff. And in a week or two, they had enough to completely furnish her apartment. But people kept donating stuff to her. So they started calling her the furniture lady because people were just dropping stuff off in her driveway. She called around, tried to offer it to all 9 different agencies, and they were like, we don't have anywhere to store it. So this is a real hole in the system here. And her husband said, hey, I think you've got a nonprofit idea on your hands here. And it was born, and they started doing one house a month, and it grew till in 2016, we were decorating and furnishing 3 houses a week here in the Metro Detroit area. And then we've expanded to 4 other cities.
So where now, are you still in Pontiac? Because I know your shirt says Detroit.
Yeah. Well, 85% of our clients that we serve live in Detroit, but we have this warehouse in Pontiac because we take donations. So to facilitate people dropping off donations of decor items, plates, glasses, artwork, we needed to have a more centralized location so that people wouldn't have to drive 45 minutes to donate.
So I will say, my kitchen table came from your place, Humble Designs in Pontiac. I was there a few years ago. I think we were working with you guys when I was with Channel 7, tried to get furniture for the Detroit firefighters and EMS medics. And while we were in there, I didn't realize you guys also had like a resale shop. Per se. I don't know if you're still doing that, but it was like a new table. I was like, oh, I want that. Are you still having a resale shop as well?
It's not on like a full-time basis, but we don't really have a good way to control the flow of donations. And so sometimes even different manufacturers will donate things to us that are perhaps a table that's way too large for most of our families. It would never fit in their home or apartment. So what do we do with that? So we try to find some way to generate money from that so that we can then help more people with that. So every now and then we'll have a warehouse sale. We had a resale auction twice upon a time a couple of weeks ago, and we think we're going to do that a couple times a year. It's an online auction where our designers repurpose some furniture, and then we had it for auction on a little site. So
that's awesome. So let's talk about the fundraising right now. Where do things stand? Because this is a hard year, and so many nonprofits that would normally have some of these big fundraising events were not able to do that because of the COVID-19 crisis.
It has been super challenging. So we typically have had a really large event in the fall called Gigs for Digs. And it was at the Fillmore, and then a couple of years ago we had it at the Opera House, and we partnered with Mitch Albom for the launching of his book, Finding Chica. And that typically brought in over $100,000 for us, and we could not do that. So we pivoted to some online events. We had a virtual 5K, and the Red Wings Darren Helm helped us promote that. And we are looking to, we had Top Golf, which we were able to have in person in October, and we have another Top Golf event in March, which is amazing because they give us a deal as a nonprofit. So you can get more for 3 hours of Top Golf at $100 a ticket with us than you could if you went there by yourself. So it's partnerships like that, working with other places that want to help us. But we are looking to do an event this fall called Welcome Home, maybe at Eastern Market, somewhere out in the open where we can set up vignette spaces for people, but mitigate too much mixing. We just don't know. We don't know what it's going to look like in the fall. So it makes planning very challenging.
Right? You're like, and these events are hard to plan. There's a lot that goes into them. And then you could do all this planning, and then, 2 weeks or even a week earlier, the state could go into a shutdown and it gets canceled.
Double the planning because you have to have your online backup. Okay, if they shut us down at the last minute, what are we going to do?
So with that, how's the need been during the pandemic for your services, though?
It has been astonishing. So in the first wave of the pandemic, from March through April, it was so overwhelming that all of the partnering agencies, we partner with 19 different agencies here in Detroit, in this area, were just deluged with people. And then they had to set up satellite spaces for people to stay. If someone tested positive, they had to go into a separate, but they weren't ready to be hospitalized or needed to be hospitalized. So we shifted to helping the helpers for a few months, where we emptied our warehouse of almost all of our sheets, blankets, small appliances, coffee makers, that kind of stuff, towels that they needed in the shelters. And then in June, we were able to go back to doing in-home. So with the shutting down of evictions, where they were not allowed to evict people, it put a weird hiccup into the system, because then everybody who was in the shelter who needed a place, there weren't available housing for them. So we just did a woman 2 weeks ago, Kenyatta, who had moved up here from the South in January. She had 2 jobs lined up. This was a year ago, January. She was staying with her aunt and with her 3 kids. She was saving up money to get a place. And then March, COVID, both of her jobs went away. So then they told her at her aunt's apartment that she couldn't stay there any longer, or her aunt would not be. There were too many people in the apartment. So she took the money she'd saved and moved into a motel, a 1-bedroom motel, and was spending all of her money on that. And then someone told her about the Lighthouse in Pontiac, and she contacted them, and they said, we'll let you stay at this motel. We've got a fund. We can't have you with COVID in the shelter. So this was in July that happened, that she moved into there. And it took her until 2 weeks ago to get a place, to find a place to live.
Wow. And that's one side of this issue. We really haven't heard a lot about. People are unable to find housing right now.
And as she said to me, it isn't that I want anybody to be evicted. And I feel so bad that these people are in such a place. I wouldn't want anybody to be put out on the street and have to go into a shelter. But there's just been nothing available.
Lisa Crawford with us here on the Megacast. She's the communications manager for Humble Design. So where are you on your donation level right now? Because a lot of people are stuck at home now. So they're going through their stuff. They call it the clutter chaos. They're clearing things out, but they're also finding ways to sell it that maybe before wasn't available to them. Like where they would donate before, maybe they are just selling it because you could do marketplace or let it go, throw it out on your porch and not come in contact with someone.
We have had such a flood of donations. So it has been managing that. Normally, prior to the pandemic, people could just drop off Monday through Friday, 9 to 5. But with the pandemic flow, we just did not have the warehouse space. We were being literally overwhelmed, drowned in it. So we had to start scheduling drop-offs and having people tell us what they were going to bring so that we could decide whether or not we needed it. Sometimes we go through a bunch of dressers and we don't have any dressers. Sometimes we have, we got 20 dressers, we've got no desks. Right now, kids' desks with all the kids that had to learn at home. It was a huge, they were sitting on the floor doing their homework on boxes. So getting desks into houses was just as important as getting beds to get them up off the floor.
So what is the best way for people to help you?
It feels...
We see your coworker there.
I tried locking him in a room. He's very clever.
No, that's okay. You'll probably hear my dog bark at some point in time.
So it sounds insensitive in a way to say money because so many people are struggling, but this has almost moved me to tears. We've had several people who, when they got their $600 stimulus, forwarded it on to us and said, I don't need this right now. I haven't had any interruption in my workflow. Please use this money to help more people. So we have seen in some respects an uptick in giving. And those who, can't, we've had people go on our Target wish list, our Amazon wish list. We really try to put books and toys, dolls that are representative. 91% of the people that we serve here are Black. And we feel as if representation matters. So they purchase books from Target or Amazon and dolls of color and send them to our warehouse. So we had several people that I can't afford to give a lot of money, but I can afford 2 Black Barbie dolls. Or it's been incredibly supportive, and the outpouring of that support has meant so much to us when so many nonprofits have had to close their doors.
And that's what's heartbreaking is to think we hear so much about restaurants and small businesses, but a lot of focus has not been on some of the nonprofits that are struggling as well during this pandemic. Have you been able to take advantage of some of the grants that have been available to nonprofits?
So we did apply for the PPP and we qualified for that and we got that. I believe it was in June. So we had, we normally have 6 part-time designers. We had 2 of our designers that left for other reasons, and we just maintained 4 to try to trim back costs. I was the director of Humble Design Detroit at that time, and we were really struggling financially. So I transitioned to the communications role nationally to alleviate Detroit from having to pay that. But 2 weeks ago, Detroit hired a new director, Chris Tall, and we are super excited to have him on board as things are building back up and we're able to get back to 3 homes. We had reduced in November, we went to 2 homes a week. We just could not afford to do 3, but we are back up to 3 homes a week right now, and we're excited about that.
So I know that you've been able to furnish over 1,500 homes now since 2009 for these families. That is life-changing for them. But what has it been like for members of your staff to have to go into homes during COVID?
We have put some safety precautions in place. So after doing a lot of research, that a lot of COVID isn't passed through surface transmission. So that allowed us to feel more at ease going back into the homes, because we did find out after we had done someone's home that they had tested positive for COVID. But we limit it to one person a room in putting the room together. We have the windows open to create airflow in there. And we try to be in and out in 2 hours with our makeover. So we've put things in place, and we have seen, there's a lot of volunteers that just aren't comfortable right now until after they get vaccinated, and that's okay too.
And so with that, do you need volunteers right now?
We always need volunteers, and what we are really needing volunteers for is sorting in our warehouse. So that huge volume of stuff that comes in needs to be sorted and put in place throughout the warehouse so the designers can then shop for the clients when it's time to decorate their home.
So I think about this. There was a tornado that went through southern Indiana, probably like 7-8 years ago. And my girlfriend and I went down to volunteer, and just the sheer volume of donations, people were driving through and dropping off. And it was like you said, trying to actually separate that. And a lot of it was clothing as well. So you had to go, sizing and what was valued and what was needed and this, that, and that. It was overwhelming. So I could imagine in your situation as well, people feel like they're helping. Yes. But sometimes if you're getting donations that aren't the right donations, it can really kind of hinder from your mission.
So we have a little cheat sheet on the website to let people know what we are looking for. And then on social media, every Wednesday, we do a Wednesday wish list, the things we're short of, so that people can, and it isn't that we don't want those other items that you have. If you have someplace in your basement or garage, you can keep it for a few months. Like 2 weeks from now, that item in your garage could be on our wish list. It's just very hard to manage the flow of inventory.
So what is on the top of your need list right now?
Twin beds and box springs, and queen. So we had a home of a single woman last week, and she was hoping to get a queen size bed. And I went back to the warehouse and I was talking with the operations manager, and she said, we only have 12 queen box springs and mattresses right now. I know it's just a 1-bedroom apartment. How big is her bedroom? I said, it's really big. It's almost as big as her living room. She said, could she take a king? Because we don't normally take king donations of beds and box springs. But she said, we have 4 right now. And if we could get rid of one of those, because a lot of our families live in bungalows and the moms are often upstairs and we can't even get a queen box spring up those stairs. So we need a full. So there's always this juggling, but beds are always a high priority. And we work super hard. We did get a small grant from 100 Women Who Care in Troy of almost $4,000 to buy beds. And if we were ever out, that we could do that. So we've got a little cash that we can do that for if we need to, but that's a challenge.
Yeah, and I wonder too, because I know when we were doing the furniture drive for Detroit Fire and EMS, we were so lucky to be able to have various organizations. Gardner White was amazing. They matched our donation. They continue to donate to Fire EMS. But it's like you said, it's the beds and like recliners, things of that nature. But now we're seeing these furniture stores like Art Van was a huge contributor and supporter of so many nonprofits here in the Metro Detroit area. What's that been like? Has that impacted your organization?
Definitely impacted us. And we had gotten a large donation from Art Van like 3 weeks before they announced that they were closing their doors. And it was, it's always like this huge relief when we get a big donation like that from Floyd in Detroit has donated a lot of furniture to us, which has been wonderful because they're modular pieces that are easy to get up and downstairs. But It is always challenging, but we appreciate so much. I saw that, Love had moved in where Art Van. And then I drove by there the other day and I saw that they were closing their doors too.
Right. That's exactly what I was thinking. It was like, wait, you were the Salvation, and now the Salvation is closing as well.
Yeah, it is challenging. And I don't know if you heard or not about the woman who had been in Detroit, who had been evicted by the police, but her landlord had was sexually harassing her and asking for sexual favors. And the police evicted her and now have said that they did that. And it was not protocol, and it was, they've apologized for it, essentially, right? So she has been on several interviews, and it turns out that we had given her furniture during that lockdown time, but had not gone into her home, had dropped it off curbside. And so now she's gotten a new place, and we've offered to furnish her new place and give her the whole complement of our services with the decorating. So that's going to be next Wednesday, and we're very excited to refurnish her place. It's, my daughter said to me the other day, these landlords, sometimes they do these things that are illegal, and they're illegal, but unless somebody prosecutes them, they get away with it. So that happens over and over.
Oh, I cover my share of nightmare stories involving landlords in the city of Detroit, especially. Lisa Crawford with us. She's the communications manager with Humble Design. So great having you on the show. I know it's the first time I think I received an email from your organization, and I was like, we haven't had them yet. So it's been great talking to you. Quickly before we let you go, how can people find out more information about Humble Design?
You can go to our website, humbledesign.org. And then you can click on the city, Detroit, that you're interested in, or any city you're interested in, or you can check us out on Facebook and Instagram. We upload happy videos and inspiring stories every week.
Inspiring stories. We all need those right now to lift us up. So thank you again for being with us, and thank you to your team for sticking out, but also doing so many good things for so many people here in our Metro Detroit community.
It truly is our pleasure.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. We'll be back after the short break.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs, even if you're looking for easy access with no cost, no prescription, and no appointment necessary. We've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local.
Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together. Together.
For the latest information, visit oakgov.com/COVID.
We appreciate you taking time out of your day to be with us here on the Megacast. Megacast. You can always catch us Monday through Friday, 10 a.m. until noon for new live or long form interviews here on the Megacast. But if you are unable to join us on the show, you can always catch previous episodes as well as previous interviews by going to our Facebook page or also by going to civiccentertv.com, and they will be posted there. Kicking off our second hour of the show on this Friday, Bryan Barnett. He is the mayor for the fine city of Rochester Hills. Great to have you with us, Mayor.
Hey, thanks for having me. I appreciate it.
It's been a while, so Happy New Year to you.
Well, thank you. It's already starting a little bit better than last year, so that's good.
It is, but then, we went through the insurrection and all of that. Let's hope the remainder of 2021 is a little bit calmer, right?
Absolutely. I mean, I'm an optimist and things seem to be trending in the right way. And so, we certainly recognize the challenges, but we look to some of the positive things that are happening both in our community, in our region, and nationally. And that's generally what I try to focus on.
So with that, how, as the mayor for Rochester Hills, how will you operate 2021 and doing business differently than 2020?
Well, so many things have, really structurally changed. I mean, the fact that even sitting here today, our building is still closed to the public requires us to reach out to our constituents in unique ways. We've had to really, harness technology and find other ways to deliver services. People's, desires to still have safe streets, plowed streets, water and sewer systems that work. Those desires and needs don't change. The way we service them has to. And so, in large measure, we've worked to kind of, reconfigure the way that we deliver services in this new environment, even the way we communicate. So we're hoping that things start to get back to normal, but we've learned a lot about ourselves in the short term, and I think it's become a better, more responsive city because of it.
There was a recent study that indicated how much the state government is saving by having so many people work remotely. Let's say we get post-pandemic. We hope to get there one day, right? Post-pandemic, do you think some of the jobs will remain remote for some of your workers there in Rochester Hills?
I don't know. I mean, I think we'll be looking at that. And one of the unique things that we're hearing now, and this is maybe a story that will come out as we get farther along, is people's desire to be back together in community with each other. And while there are some jobs that probably could always have been done from someone's living room, I mean, I think and I'm a personal believer in the fact that there is a benefit to being in community with others. I think more ideas are shared, more innovation is uncovered. And so most of the folks I hear from on my team are like, Mayor, when are we coming back? When can we come back? How soon can we get back in there? Can we come back in now? And so I think that the majority of folks in our industry, which is a very forward-facing, we deal with residents, whether we're cutting trees or welcoming them into our parks or servicing from our Department of Public Services Department. They really deal with the public, and I think are missing that in large measure.
It is so true. With that, how's the budget looking there in Rochester Hills? Because we know the pandemic, there are so many entities and businesses suffering. How's that impacted your bottom line?
Yeah, well, I mean, it's a significant concern. I mean, to be very honest with you, like most of the communities in Southeast Michigan, the budget challenges that we've had have been largely met by federal funding. That sort of stopgap funding has been really critical to keep us going. The challenge as we move forward is exactly what you identified, and that is that the real folks that are in a tremendous pinch are our small businesses. And should those be challenged in a way that they not continue to operate, that many of them close in a great percentage, that in turn obviously greatly impacts the property taxes, the values of property in our community, which ultimately funds the cities in Michigan. And so we're really on the precipice. We've been okay. I think everybody's been damaged because of this COVID environment. Some of that has been made up for by federal funding. Of course, we're in the middle of some CARES 5 or 6 or 10 or whatever CARES project it is now. More additional funding coming to cities, and the Biden plan is talking about that. But the real thing that I'm concerned about, what I'm really, really watching, of course I'm watching my budget, but I'm really watching the small businesses in our community because those are the ones that really need to succeed. That's the backbone of the economy in a place like Rochester Hills, and that's the folks I'm really rooting for now.
Yeah, but they also shape the character of a city as well.
I can't tell you how many people have seen me or have called me, contacted me, and said it's so nice to be in a restaurant again. Because in a community like Rochester Hills, I mean, we're a decent sized city, probably close to 80,000 after this next census, but there's still a real small town feel. We know the people that own our restaurants. We know the people that have served for many, many years, oftentimes in those places. There's a relationship. There's a real familial experience in most of the places around here. And so, I think our community is going to really step up and support those folks, those small business owners that have long been the folks that we go to when the schools need support, when we want to fund our fireworks, when we want to have a parade. Those small businesses step up time and time again. And now is the time for us to show them the same support.
Yeah, but Mr. Mayor, I will say so many people have been doing so, but we're now almost 11 months into this. And so you wonder how long can that support go on? But when you hear from some of these small businesses, especially the restaurants, when, like the governor wants to get up and they talk about some of these programs and grants that are available, that money goes so quickly. So many of these businesses are not able to take advantage of it. So there is a gap there between trying to make them thrive and survive and the realities of getting them there.
No, absolutely. And I think, there'll be a lot of lessons learned, and we've seen a lot of different states handle this process differently. There'll be, I'm sure, no shortage of Monday morning quarterbacking to see which states did it well and which regions, even in states, did it better than others. But there's no doubt that we need a sophisticated approach to this. The vaccine entering the communities, I think, is hopefully going to give people more confidence to get back to a more normal sense of life. But they are truly at their breaking point. They really are. And small businesses, even restaurants now in Michigan, open at 25%. You ask most restaurant owners, they can't make a living at 25% capacity. They can't make hardly a living at 50. They have very small margins that they operate on. And so this isn't helpful for them. The movie industry, yes, they can be open, but there are new films at the moment because that industry has been off for some time. So just because the spigot is turned on doesn't mean that these folks are out of the woods yet. And you're exactly right. We're going to have to, as a community, as people that live in a region that supports these small businesses, we're going to have to make a conscious effort to do more than we typically have in the past if we want to see them survive.
Bryan Barnett with us here on the Megacast. He's the mayor for the City of Rochester Hills. I've tried to eliminate my Amazon purchases because it is easy, right? Boop, swipe. I don't even think I have to swipe anymore. It just, goes to the credit card and shows up at your door. But I've tried to stop doing that to get out into our neighborhoods to try to find these businesses to support them. And we encourage everyone to continue to do that. But as you said, the restaurants are reopened. We are going into Valentine's Day weekend. But what is the issue or how are you handling some of the complaints that are coming in about businesses not adhering to these restrictions for COVID-19?
Yeah. Well, for the most part, those restrictions go to the county. We don't have enforcement jurisdiction. Obviously, if there's something really obvious, but we use the sheriff's department here, and they're not, in buildings enforcing 25% capacity or masks or something unless there's a significant disturbance or issue. So for the most part, that's the county health department, and it's unfortunate. It's really a tough thing. You see these restaurants that put a lot of money into igloos and changing their outdoor seating area to allow it, and they're struggling. They're trying to do what they can do to keep their employees employed and to make a living. And they're also trying to understand rules that change a lot, and oftentimes within a couple of days, and they see what things are going on in neighboring states. And so it's really challenging. Like I said, I have a tremendous heart for the small business owners in our community because I've seen what they've gone through the last 11 months. And the number one thing that kills a business is uncertainty. And there's been nothing but uncertainty for the last 11 months. And so it's very difficult to invest. It's very difficult to know, okay, listen, I'm gonna spend $10,000 to retrofit my outdoor patio with igloos, but then find out that you can't do it because a certain heater isn't approved, or you have to, those restrictions, and now there's a curfew that ends at 10 or something. So uncertainty is the death knell of most businesses, and we've got to do something to address that.
And that is such a great point. I didn't grasp the reality of that until years ago. I went to Kosovo, and businesses were not going into that country and investing because of just that, the uncertainty. And when you have that, the dollars and the investment do not follow. And so it's such a great point that you brought up there. But with that, you guys are still trying to be innovative and continuing on there in Rochester Hills. I've been on your website, and I have to ask you, it's like you have on your upcoming events list, you have the Michigan Ice Film Festival coming up, but also the Antler and Bone jewelry making class. I'm like, that's creative.
Yeah, what we found, there's always some blessings, right? In every storm, there's storm clouds, there's some silver linings. And what we found here over the last year is that people love our parks. They love and appreciate our park network. And so we've been doubling down and investing in those over the last year. Innovation Hills, our newest park, is the kind of famous because it has all glow-in-the-dark sidewalks, only place in Michigan that has it. We just broke ground on a $4 million playground, probably the biggest playground in Michigan over the last number of years. And so not only are we investing in our parks, we're also finding that you can do a lot of outdoor activities. The event that you just mentioned is one of a series of outdoor events that we're having. And every time we have them, they're populating quickly. They're filling up. We're selling them out. And it's a chance for families to do something. They don't have to travel. It's close to home. It's a unique experience. And it's a great way for us to step up and fill the void that's being created by so many things being closed for so long. People are returning to their local parks, and we're taking advantage of that.
That is awesome. I have to ask you, as someone who is an elected official and the mayor there in the city of Rochester, what has this pandemic, how has that impacted you on a personal level, and how you operate as well, being the mayor of the city?
Well, at the beginning of the pandemic, I was not only the mayor of the city of Rochester Hills, but I was the president of the United States Conference of Mayors. So I was the mayor of the whole country, the mayor of America. And so I was at the White House quite often. I was, believe it or not, on all sorts of Zooms and meetings with Dr. Birx, Dr. Fauci, and many of the others, kind of crafting the policies and representing mayors across the country. It was incredibly demanding. I had COVID. I had to isolate myself away from my family for 10 days, was significantly sick for a couple days, not terribly. So it impacted me personally in that manner. And now, I think I've realized there are so many different perspectives out there on how this has changed the American experience, from one that we've covered quite a bit, the business owner's perspective, but also, the other thing that we're really challenged with is education, right? So many parents trying to get their kids back to school, wanting to get some sense of normalcy back in terms of education. We saw what happened in Lansing with the return to play. Of course, there's a segment of the population that is concerned about returning to normal activities. And so, that's another thing in our community that I think is going to have a really long-term impact, is this year of education. Where have we gone as a country? How far are we now behind other places in the world? Did we all sort of lose a year? How do we, deal with some of the mental health issues that have resulted from this? And so you asked me how it's impacted me. It's forced me to look at a lot of different perspectives. Anytime you mention the word COVID, there's about 9 different ways I hear that word. As a father of school-aged kids, as the mayor with businesses in my community, as an employer with 600 or 700 employees, trying to understand how this works. As an elected leader, trying to give calm and sense to a senior citizen who emails me and says, I'm 87, I can't get the vaccine, can you help? There's a lot of different ways you have to look at this. And I guess that's probably the one life lesson, or the one real practical takeaway that I've come away from, is like, you need to stop, pause, and think about this in a lot of different ways.
And that's what's so hard, is you have to honor and respect everyone's views and wishes, and they may not be your own. But also on that, as the mayor, there are a lot of restrictions put on businesses within your community that you have no control over. Do they understand that you're not the person that made these decisions?
Sometimes. I mean, it's the same thing with schools, and I've got people saying, Mayor, just let them go back to school. Well, that's of course not my call. Or Mayor, let the businesses stay open until midnight. Of course, that's not my call. Can't we, throughout the course of the pandemic, can't we go fishing? Can't we go golfing? Can't you just make this happen in your city? And of course, part of it is understanding, where the authority lies. And of course, as a city, most cities, certainly in Michigan, don't have their own public health departments, so we rely on the expertise from the county or from the state. So, I don't want to be in the position of making health-related decisions for my residents, but I am in the position to get as much information as I can, distill that information, and then disseminate that through appropriate channels to as many people as possible. So, there are always people that are concerned and confused a little bit about the levels of government and who has the authority. And this pandemic has probably clouded that a little bit. But one of our most important jobs in elected life is to share information and to make sure your population, your constituents, are as educated as possible so that they can make the best decisions for themselves and for their family. And we spend an awful lot of time doing that here in Rochester Hills.
Well, Mr. Mayor, we so appreciate your time and your perspective as well. Anything I didn't touch on that you want to share with our listeners and viewers before we let you go?
Well, we appreciate your listeners and viewers and would always welcome them to Rochester Hills. We are open for business. We've got some great places here. And if you haven't ever been to some of our parks, Innovation Hills, Borden, Bloomer, Spencer, take a look at our website. It's a really cool experience, not more than probably 10 minutes for 15 minutes from your listeners' area. And we love to invite you here to Rochester Hills. We're pretty proud of our community and we love showing it off to others.
Well, that's great. Thank you so much for being with us. We appreciate it.
No problem. Have a great day.
We're going to take a quick break here on the Megacast.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/contain-COVID.
Just about 40 minutes left here in the show on this Friday morning. And with us next, Mary Ellen Kearney. She is the Corporate Relations Director for the Karmanos Cancer Institute. You guys do such important work here in our community. Thank you for being with us.
Thank you for having me. We're always excited. Any chance I have to talk about Karmanos, I am excited about that. So.
I will say my stepfather had cancer several years ago, and sadly he passed away, but Karmanos was such an important part of his treatment. And so it really is a blessing to have such an organization here in our community. For those that don't know the background though, how did you even get started?
So Karmanos has been around since, the 50s here in Detroit. And we are one of the only two NCI, which is the National Cancer Institute, designated comprehensive cancer centers here in the state of Michigan. And we have been working tirelessly within the community to bring new treatments and the best patient care to the community and really hope for the best outcomes for those patients.
Yeah, you really are on the front lines of the research and experimental treatments when it comes to cancer. And sadly, so many people have known someone in their lives that have been touched by cancer. But what's it been like during the pandemic, especially now, because so many people are afraid to go into a hospital or into a treatment facility?
Yeah, so one of the things that we keep telling people is COVID stopped so many things, but it certainly did not stop cancer. So we have to continue to encourage people to come in and feel comfortable. So we have what we call safe care, and that is following all of the standards that are set for guidelines to be safe and healthy for patients to come into our facilities. However, we feel that we have a step up because we've always worked with immunocompromised individuals. So we've always been very aware of disinfecting and kind of social distancing and how to really make people feel comfortable. But we have so many guidelines in place, whether it's visitor restrictions or how we're cleaning, the use of masks, screenings prior to coming in. So we encourage people. Yes, it's a scary time. There are a lot of unknowns when you're coming into a facility. Cancer itself is so scary when you add all of that together, but we're still here for our community, and we're still here to give everyone the best possible care that we can.
And we all know that the longer people put off being diagnosed, the worse chances they have for survival. But yet we're in the middle of a pandemic where so many people aren't getting their yearly screenings or any screenings. You know, we're told to get a mammogram, colon cancer, go get a colonoscopy, but so many people right now are afraid to do that. Are you worried that we're going to have an explosion of people that by the time they're diagnosed, their disease is going to be so much further down the line, which will make it harder to treat?
So I will say we have definitely seen, I think nationwide, we've seen a drop in cancer diagnoses, and that is because less people are coming in for their screenings. And yes, as you mentioned, the earlier you catch something, the better the outcome is. My hope is that things like this show will encourage people to get in for their screenings that they may have missed, and so that we don't see that kind of backlog of people and more people coming in too late in their stage of cancer, where their treatment options will be limited.
So as a leading institution, how are you trying to address that gap right now?
We're really out on the front lines, just encouraging people, telling people, you can come in for your screenings. We're going to take care of you. If you can't come into our main campus, we have campuses all over the state of Michigan. Our Lawrence and Adele Weisberg Treatment Center in Farmington Hills. Any place that there's a McLaren hospital, we have a Carmanis location as well. So get in. We just can't say that enough. And so again, that's why we're so thankful for opportunities like this, because we can remind people early detection is what saves lives.
So with that, I know that clinical trials are a big part of what the Carmanis Cancer Institution is a part of. Have you seen a drop in participants during the pandemic?
You know, I don't know the actual numbers on things, but I will say that our clinical trials program is one of the best in the country. And throughout COVID, we have continued to provide those services for our patients. So oftentimes when someone goes on a trial, they are able to be on that trial or that treatment for as long as it continues to be effective for them. That has not stopped because of the pandemic. So we are still involved with clinical trials, still recruiting for clinical trials, and still seeing success with the people who are there.
Mary Ellen Kearney with us here on the Megacast. And so we know that a big part too of the Cancer Institution is about fundraising. And it's like you said, you're a staple here in our community. We all know about your organization, but fundraising is really tough right now. How's COVID-19 impacted the fundraising efforts there at the institution?
So just like we've heard about with small businesses, we are being impacted. People are keeping a close eye on how they spend their money right now. And unfortunately, I think supporting nonprofits is often one of the first things to go when people are having difficult times with their money. So unfortunately, our numbers are down. However, our team is is geared up for this new year, and we're excited to say, okay, 2020, we're not saying 2020 anymore. We're going to say it's 2021, and let's move forward. And so that we are continuing to focus on new and innovative ways. And I think we saw a lot of that, especially towards the end of last year, with people getting really creative with their fundraising. And that's what we plan to continue to do.
Yeah, but we were talking with Humble Design. It's like you could put so much time and effort into some of these fundraising events, and then restrictions change or something happens like a day or a week before. So is it like a flow chart now? Because we've been so used to, after nearly a year of this, having to change on the dime.
Absolutely. We actually just had a committee meeting yesterday for our largest fundraiser that's supposed to happen in September. And we're at this point where we can't sign a contract with our venue, but we know what our venue is. And so just trying to determine, okay, do we still plan to move forward with what the original event looked like? Are we going to change it? When are we going to change it? How many more times will we need to change it? So yes, there are, rather than the usual straightforward approach to doing the event, there are about 6 or 7 plans, and each one of those plans then has its own set of sub plans. So it's very, very involved right now.
Well, and on top, I would think it's also costly, because if you're trying to sign a contract with an event, but then you can't use the venue, there are going to be clauses within those events. And now that we've had time to go through this, some of these facilities have gotten a little bit smarter about this too, where they're saying, wait, we're holding this, we can't continue to lose money as well. So it's so challenging, and the challenges aren't going away. In 2021, it's going to be with us yet a while longer. But does it help to have an organization such as yours that is so established, to have that name behind you when you're going to for the corporate sponsors?
Absolutely. I mean, everyone knows who Carmanis is, and we're very proud of that. People know the work that we're doing, and we do have so many strong relationships with companies. And as you mentioned, venues with their contracts. We're lucky that we have these relationships, so we can have actual discussions with people and remind them of why we may be not signing a contract, or why we still need their support, and how their support maybe will look different this year or last year, but how important it still is for our community and for the survival of Carmanis and our patients ultimately.
Yeah, and we need you to survive, because you're such an important part of our community. But how does it change? Like, if I'm just a regular person sitting at home, is there a way for individuals to support what you're doing?
Always. So we are always open to donations, and I tell people, whether it's $5 or $500,000, your money will be put to good use for patient care and new treatments. So there's always the opportunity to make a donation, which of course can be done at the carmanis.org website. But there are other ways to be involved as well. Right now, we're unfortunately not doing a lot with volunteers in-house because of COVID restrictions, but we do always have opportunities for volunteers and for people to get their companies involved, whether it's a jeans day or a bake sale, those kinds of things. We always encourage people, whatever way they want to get involved, they can get involved. And one of the things we were just talking about as a team was the fact that sharing your story is so important. So for those people who have been seen at Carmanis, sharing that journey with other people, it encourages them to seek the treatment that they need at the top hospitals. And it also sometimes gives people a chance to see someone that they connect with and can say, oh, this person is sharing their story. I see myself in them. I can also share my story. And the more we talk about it, the better outcomes we have for our patients, because more people are coming in.
And so with that, how important has social media been to your organization during this time?
Yeah, it's huge. Social media is the wave of the future, I guess.
It's free too. I mean, that's the thing with some of these companies that don't have it. I'm like, but it's free. You just have to know how to utilize it.
Absolutely. Yeah. So we're always talking about the great things that are happening at Carmanis, whether it's clinical trials or featuring a story about a patient or a doctor or a new treatment, plus giving opportunities for fundraising. And we encourage, again, other people, if they want to use their social media to fundraise as well. So it goes kind of back to that planning where we have our one approach with many, many branches. And social media is so great for that. And it's the way people are connecting now. And I have a feeling for quite a while now they'll be doing it as well.
Oh my gosh, goodness. And there's a lot of good with social media. So we like to focus on the good, not necessarily some of the other stuff that's going on with it as well. But with that, Mary Ellen, and I don't really know, because I know you're with corporate relations, so I don't know if you can really even answer this question, but we are hearing, obviously, everything in 2021 is about the vaccine. For your patients, are they able to get the vaccine through Carmanis and through their doctors, or not at this time?
So we are in the process of providing the vaccine for current patients. We, like everyone else, are sort of waiting, and as we get them, that's how we release them. But yes, we are thankfully at the point where we have the ability to offer it to some of our patients who are in current treatment.
So before we let you go, can we talk a little bit more about the cancer screening? Where can people get them? Should they go to the regular doctor? Can they come to Carmanis? What's the best way for them to do it?
So, I mean, screenings in general, we encourage people to see their doctor annually. They may be able to recommend specific screenings that you need based on your demographic. And if you have an issue that you bring up with your doctor, which we, again, encourage people to be open and honest with your doctor. They cannot help you if they don't know what's going on. So yeah, seeing your doctor is the first step, and then they can help you with your screenings. I will say we do screenings at Carmanis. Mammograms in particular stand out to me because you do not have to have an active cancer diagnosis to be seen for your mammogram at Carmanis. It's where I went for my baseline because I believe having the experts reading my results makes the most sense. So coming into Carmanis and setting up your appointment there is wonderful. We offer other screenings as well, but yes, always start with your primary care doctor, and then when they need to make a referral, ask for a referral to Carmanis.
Absolutely. Hey, before I let you go, I have to say, so we had the tragic death recently of Jamie Samuelson, well-known sports individual here in the Metro Detroit area. When he passed away, prior to his death, he came out and he went public with his colon cancer, and he was so young, in his 40s. When someone with a high profile comes out and they talk about their cancer, does that help your organization in some way, just from the standpoint of trying to educate the public?
Absolutely, tremendously. Again, people don't want to talk about those things. Hearing the word colonoscopy makes people uncomfortable. Mammogram, that makes people uncomfortable. All of these things are things that people don't want to talk about, which is often the reason that people don't come in for screenings or talk to their doctor when something feels off or wrong. So when somebody, who is in the spotlight shares their journey and makes it a normal part of conversations in society, that helps, because then other people feel comfortable as well. And again, maybe recognize some things in themselves that they're able to then take those steps and come in for screenings.
Mary Ellen Kearney with us here on the Megacast. She's the Corporate Relations Director for the Carmanis Cancer Institute. Anything I didn't maybe ask you that you want to share with us before we say goodbye today?
No, just a reminder to get screened, and if you have the ability to get involved, please get involved.
Absolutely. It's great having you with us here on the show. And we want a happy weekend and happy Valentine's Day as well.
Thank you. You too.
We're going to take a quick break here on the Megacast. And when we come back, we are going to be speaking with the president or the owner of the Great Lakes Yurt Company. Do you know what a yurt is? I learned something new today. This is the Megacast.
COVID-19 has caused many families to fall behind on finances and on groceries, but you're not alone. You shouldn't have to worry about putting food on the table. MyBridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Thank you for being with us here on the Friday edition of the Megacast. Just about 20 minutes left in the show. We'll round out this week. And I have to say, when I first saw this next guest on our list, I was like, huh? I thought we were talking about a yogurt company. That is not the case. With us now, Steve Carroll. He is the owner of the Great Lakes Yurt Company. Steve, thank you for being with us.
Thanks for having me.
Okay, am I the only one who didn't know what a yurt was?
Not at all. No, that's very common occurrence. And the yogurt, cross-reference has been done many times for sure. Some confusion there.
Oh, good. So I don't seem like, or I don't feel like such a dumb blonde then.
Not at all. Don't.
So what is a yurt?
A yurt. So a yurt is a round wood-framed structure wrapped in canvas, similar to a teepee. So it's a Mongolian design. They've been used in Mongolia for thousands of years by the nomads, easily movable. They follow the herds of the grazing animals around. Kind of turned into an American culture thing in the camping industry and some of the counterculture industry, yeah.
It really is an amazing little building or hut per se. But with that too, I would think during the middle of this pandemic, have you seen an increase in sales or people wanting these?
We've seen a huge increase in sales. So, a lot of it, as soon as the pandemic really rolled out last March, we saw the slow of sales. Normally March is a real big month for us. A lot of people getting ready for the warmer months. So March was really slow. About mid-April, we got really busy. A lot of people are using their recreational property that they haven't done anything with in years and always talked about. And a lot of people have had a lot more time at home, a lot more time with the family. And I think that spurred a lot of it. And then the other side is the camping industry. A lot of our yurts go to campgrounds, Airbnb type locations where people are just getting away, getting back to nature. And that industry has gotten really popular as well with COVID. So that's been a big part of our sales also.
It really is fascinating. I'm thinking about people who maybe bought a piece of land up north or along the lakeshore and they haven't done anything with it. This is a great thing, but do you need a permit to actually put your yurt up?
Yeah, well, that depends a lot on where you're at, across the country or across the state. Every municipality has their own ordinances and their own zoning laws, and it also depends greatly on what you want to use it for. We get a lot of people that want to use them as permanent dwellings and live in them, and we have a lot of people that do that. It's a little more for the hardcore outdoor enthusiasts. I don't recommend it for everyone, and it just depends.
Because there's no bathroom in it. You'd still have to have an outhouse, right?
Well, you can put bathrooms. You can really do anything you could do in a house in a yurt. Definitely, you can do full plumbing and electrical and heating and cooling systems. So,
but if I do a yurt, because it is canvas, and we're talking about Michigan and snow, can it collapse?
No. So our bigger yurts are structurally engineered to meet all the codes in Michigan as far as wind speed and snow pounds per square foot of snow load. They are framed out really good. It's a canvas covered structure though. It's thin walled. And that's the biggest difference. Is it's got a thin wall that you can hear through. The sound travels, and it's a heat management program. We insulate our yurts. There's several layers of liners, and they're insulated. We've got full size locking doors, full insulated, double hung or single hung windows. It's just a thin wall structure.
So Steve Carroll with us here on the Megacast. He's the owner for the Great Lakes Yurt Company. How in the world did you get involved in this?
Yeah, it just fell into my lap, really. So I'm a local builder here in southern Michigan and Grass Lake, Michigan. I had a friend who had this wild project idea to put a yurt on his little farm and move a guy into it and film a documentary and get him back to nature, really. He's a city kid. So that's where I came in, was the yurt. We looked at kits to build yurts, which there's several companies in the United States that have been around for a long time, mainly out on the West Coast. And we looked at the price, and it really wasn't in the budget. So we got some plans and built our own yurt.
So so I will say, so I went to Africa, and as part of our trip, at the end of it, we went on a safari, and this kind of reminds me of the tents that we stayed in. It's like glamping, ultra high level, but these are not something that, you put together quickly. It's not a pop-up tent. What is the process of actually putting it together?
Yeah, so we do recommend they go on a solid foundation. Wood framed is normally what people do. It's an elevated wood framed foundation. It's a circle deck, basically. And the yurt really only takes a couple days to put up with our kits. They only take a couple days to put up, and that's been a big draw with these people that have property in a lot of northern Michigan or lakeside properties where they want to have something to use, and within a week or so you can get a structure, weatherproof, lockable structure that you can use, and it's affordable.
Steve, this is glamping.
Absolutely. We fell into the glamping world, definitely. I'm an old hiker, camper. The glamping word was a bad word to me for a couple of years, though. But as the yurt thing came along and we've embraced it, it makes a lot of sense to me, definitely. And it's actually got us into, a lot of our customers are campgrounds and Airbnb hosts, and it's actually gotten us into that game a little bit. So we bought some property in the Upper Peninsula last year in Paradise, Michigan, on the Sheldrake River. We put up a few yurts for an Airbnb style campground that we started a little bit last year, but we just got permits and we're all legit to go full this year. So
You're like, yeah, we kind of did this glamping thing. Steve, you need me as your marketing person because glamping is where it is. So when we went to Africa, we were like, we need this in the United States. This is so awesome. But with that, I know there's been such a huge shortage for so many of these restaurants trying to get igloos and garden sheds. This really seems like it could be a good supplement for them to be able to even utilize year round. Have you seen more of these restaurants taking advantage of this?
We have. We've just started getting into that. We've got one of our bigger yurts at a restaurant in Traverse City. That's a bar, and they've got a lot of food trucks in the parking lot in the summer. Well, in the winter, the parking lot is empty, so they put up a a yurt a few years ago that they did music events and different type of events that was very successful. And then with COVID, we ran into the issue of the restaurants closed down, right? And one of the ways to get around that was to have private dining areas. And the igloos we saw a lot of, even before COVID were started, just to make good use of this outdoor space that in the winter normally sits empty. So I have a good friend of mine, Jason and Susie Povich. They own the Grateful Crow in Chelsea, Michigan, a new restaurant that actually opened amidst of COVID, trying to figure it all out. And they contacted me about doing some smaller private dining yurts to fit with the COVID regulations. And so we've got their patio with, I believe there's 6 yurts over there now. They're smaller than what we normally do. They're a little different than our normal yurt, what we normally do. They're a lot smaller and just a little bit of the design. Our normal yurts have full doors. These ones are basic, like flap doors, but they do have heat in them, and they've been great for the restaurant, from my understanding. They've made a huge difference when you couldn't really do anything before besides takeout. And now they can actually provide a space. And even when COVID isn't an issue, if you've got a successful restaurant and a full dining room, you could always use extra space.
Right, and you can charge extra because it will be that private dining experience, but you can really kind of check these up and make them cool, or make them, that outdoor camping type thing. You probably just cringe when I said check them up. I see you. You're like, no, don't do that.
No, and it's what it's done for, like the Grateful Crow. They're good. They really have an eye for design and look, and they've turned into a little village outside of their restaurant. It's with all the snow on it, and it's lit up. It's really beautiful.
So with that, because one of the things that some of the restaurants are running into with the igloos is that heat, cold, because they're trying to put space heaters and keep them warm inside, but yet you're facing Michigan's winters, and right now we're in a polar vortex that they're starting to rip. This seems like it's built like on a wood frame, right? And then heavy duty canvas. So yeah. It maybe wouldn't be fall victim to the temperature changes like that.
No, they're definitely durable. The material is it's all fire retardant and mildew resistant, and it's mainly marine type materials that we use, and it's been proved in the marine industry for years, and they're very durable. I would be very surprised to have anything rip.
So I'm looking at your website, and it's durable materials, affordable pricing, easy assembly.
That's true. That's true. A lot of our customers put up the yurts by themselves. Some of them have really no experience with tools or erecting any kind of structures, and we've had a lot of great success stories. And people, we've over the years we've designed our kits to kind of get them down and try to make them as simple as possible with the best results. And I think we've got that. The last couple of years it's been fun. Selling yurts is fun. The yurt people are the greatest. They really are.
So Steve, I want to tell you it's Valentine's weekend, and I'm going to be asking my husband that there's a small plot of land over near our house, and you can't build on it, right? But it's near the lake, but I can put a yurt on it. So that's going to be my Valentine's request.
There you go. Have him give me a call. We can work something out. And that's a perfect type of property for a yurt. It's these properties that aren't buildable. And they're actually, if you look at, some of the properties up north that aren't buildable, but they're by water, they're very affordable, and you can put a yurt. And the thing about the yurt is you can take them down quicker than you can put them up. So they are mobile. You could put it up somewhere for a period of time and take it down and move it to a different piece of property or that sort of thing.
Give us a price range.
Anywhere from about $7,000 to up to $20,000.
So it's similar to maybe a tiny house?
Absolutely. We're definitely in the tiny home group.
Do you expect that the yurts is going to explode this arena for people to buy these?
I hope, I hope, but expect, I don't know. We'll see. It's an industry that's been growing for years. The glamping industry has thrown a lot of fuel on the fire of it. The tiny home thing, even though, like I said, I don't think it's necessarily the best choice for everybody for permanent dwellings, but so we have a lot of customers that do it and thrive and love it. I hope it lasts. We're going to keep doing it as good as we can and try to keep it going for as long as the wave lasts.
I will tell you, I'm sitting here and I'm like, I want a yurt.
So the outside of a yurt is one thing. You walk inside of a yurt, it's very upscale. The outside, in my opinion, they're very simple. They're very, there's not a lot to them. Inside is really the roundness, and you've got the exposed woodwork up against, so we've got an interior liner that's also mildew resistant, fire retardant. It's white and easily cleanable. So you have that contrast from the wood in the background. The inside is definitely where it's at in your yurt.
That is so awesome. And again, before we let you go, I just love this, by the way. What is your website?
www.greatlakesYurtco.com.
And I would assume you have social media as well.
Yeah, we're on Facebook and Instagram, and we're not the best at keeping it up to date, but we try, and we've got we're all on there for sure.
Okay, I am going to say, Steve, you need to get a check on your marketing team, because glamping is where these things are going to go.
Yeah, I won't argue with that. You are absolutely right. Marketing is not my strongest suit, but we are growing, and we do have good people on the team, and we're trying to figure out how to hit it with the masses. And we've got our product now. We're very confident in what we're doing and putting it out. We have, the last year especially was just great, flawless, no problems, nothing but happy customers. So we feel like our product is at the point where we are ready to hit the masses.
That is so awesome. I will also say this is a great opportunity for so many businesses and restaurants that are struggling to find the igloos and the garden sheds because they are sold out right now. This is a great product, but also it's cooler and it's local. You can support Michigan. Steve, so great to have you with us.
Thank you. Thanks for having me. And one more note, that pricing that I gave you doesn't really, the restaurant yurts are smaller and they're not really on our website yet, but the pricing is a lot lower on the smaller restaurant type yurts. So that pricing I gave you isn't quite accurate, but appreciate your time. Thank you very much.
You've been so fun. Thank you for being with us.
Thank you. Have a great day.
You too. Hey, Tyler, did you know what a yurt was before today?
I had heard about a yurt before today, but not quite understood what it was in full detail. So it was good to get some more information on that from Steve. Yes.
So I will say, I go out walking in the afternoons, and there is this little piece of property that is across from Cass Lake. It's tiny, so you can't build on it. And now I'm seeing this yurt, and I'm like, oh my God, that is absolutely the perfect thing. And it's only 2 blocks from my house. So if I had to, I could just walk home to go potty.
Yeah.
But I could spend all day there, right across from the lake.
Not a bad idea. Not a bad idea at all. And, I know we had this conversation in our text messages with our production team here, but, it's a great place to store some comic books.
I will say that is one thing I don't think I could, that would be the one way I could try to sell it on my husband. However, he's very much into temperature controlled.
Of course.
Let's just give those words. But I love that this is available. And I will say, when it comes to the pandemic, there are so many other options out for people. And as Steve was saying, they are doing some of the smaller ones, which are really perfect for some of these restaurants to come up with. I've seen people starting to use also like the army tents, which would be that heavier canvas. But this is so much better. And I have to say, you have to go onto the website. It is Great Lakes Yurt Company, co.com. And when you go on and you see the pictures, you'll totally understand what we're talking about. I see this as glamping 101, and glamping is the rage. That is how I'm going to sell it on my husband. We could buy this little piece of land, put a yurt on it, and I'm going to sell it as glamping for the chicks over here in Oakland County.
Especially over the summer when Cass Lake is the place to be in our local area. The lake's great in the summer.
See, I'm just all about these business ideas, and it all comes, I'm blaming it on the Megacast.
Well, that's a good thing to blame it on. It's a good outcome, another good outcome from our show here.
Well, everyone, enjoy your weekend, and happy Valentine's Day to everyone out there. This is the Megacast.